Good evening and welcome to Abeer MedTalk. As one of our ongoing programs of Abeer Medical Group to create more awareness among the viewers, patients, as well as across the board of social media crowd, we have been discussing various medical topics with specialists like urologists, pulmonologists, gynecologists, general surgeon, and orthopedic surgeon, etc. Today, we have Dr. Nidhi Elizabeth, ENT surgeon, discussing with us the subject of allergic rhinitis, which is at length. Doctor will be discussing various issues, etiology, prognosis, diagnosis, mode of treatment, and various other things related to this particular issue covering under ENT. So Dr. Nidhi, welcome to our program.
Thank you.
And to begin with, if you can explain the viewers what is allergic rhinitis.
Okay, allergic rhinitis, as the name explains, it's rhini means nose and inflammation is the itis part. So it's nothing other than inflammation inside your nasal cavity. So what happens in allergic rhinitis, if the patient is allergic to dust, cold, or this bahura, all those things, immediately when it gets inside your nose start reacting to it. So allergic rhinitis is a type 1 hypersensitivity reaction mediated to immunoglobulin E. Okay, so what happens is these immunoglobulin E are ready to receive these allergens. They are commonly seen in abundance in nasal cavity and in the conjunctiva of the eyes. So immediately when the patient inhales air inside the nasal cavity and when the allergen is present inside the air, our body is trying to react to it. Usually it is not like hazardous to our body like smoke or cold or dust. It's not hazardous, but it is overly reacting to it unnecessarily. That is the problem. So it tries to flush it out with running of nose. It tries to block the nasal cavity so that not too much enters inside. Like that, body is overreacting. That is allergic rhinitis.
Allergic rhinitis, which is your body creating a natural resistance to protect itself from various allergic elements which is coming through the nose.
Through the nose. Need not be reacting to it, but is overly reacting to some common things.
Okay. And this is as a disease. When people come to you, different age groups, or is there any particular?
Anyone can develop allergy at any time. So kids can develop it, an adult man can develop it, an old age man can develop it. Any point of time you can start to an allergy. Develop allergy. If I was not allergic to it yesterday, today may be the first episode of allergy. By then, the rest of the life, I can have allergy to the same thing.
And the relevance, particularly when we are in Saudi Arabia, we live in a desert country where we are exposed to a lot of dust, sand, and minute micro particles, etc. So, do you think the relevance of this particular rhinitis in a desert tropic region is
definitely there is more dust here. Rather than the desert condition, I will say the air conditioned rooms are more a problem to the patients because the filters will be having molds or fungi in it. It's not regularly serviced or anything, so too much old dust particles will be coming out of the air conditioner regularly. So more than the dust, patients are having more problems from the air conditioners.
Air conditioner as a source of additional infiltrator or more exposure to that. Where you think, on the one hand, you think air conditioned atmosphere is hygiene, but at the same time, at a minute level, it can be hazardous as well, particular.
If it is not regularly serviced
in this particular. Generally, anyone, for myself and like anybody will ask, like, is it hereditary or?
Yes, it is hereditary. If a patient's parents or grandparents have allergy, then definitely the patient can develop allergy. Then definitely he can carry it on to his next generations also. Both hereditary factors are there and environmental factors are also there. If a child is growing in a household with cats and pet hairs and all, he might not be that much allergic like an other person who is exposed to it at a later date.
Like in any other diseases, this can also happen as, you know, it has its connection with the hereditary or
connection
genetics
is
or
definitely
whatever.
there. Definitely there is hereditary connection.
Yeah. And what about this disease causing difficulties for other diseases, like you know, like
other
for example,
diseases, more than other diseases, I'll say more like local effects are there, because our tears are supposed to drain into the nose through a nasolacrimal duct. So as a part of this inflammation, tissues inside the nose becomes bigger and block this duct so that it can't drain inside nose. So what happens is it will overflow. The patient will complain of running nose, puffiness of eyes, etc. Then there is another tube opening back of our nose which is supposed to ventilate our ear, eustachian tube. When this tube get blocked, then again patient will complain of blocked sensation of ear and sensation of fluid inside the ear. That can happen. And when the allergy goes on without getting proper treatment, that can even result in formation of allergic nasal polyps inside the nasal cavity, which can either partially or completely block the nasal cavity. So as a result of the blockage, again the sensation for smell, the nerves are high up in the nasal cavity, the roof of the nose. So the smell, that particles are not reaching there because of the obstruction. So patient will be having loss of smell. And as a part of loss of smell, patient won't be even able to taste his food also. So multiple other things can happen because of this allergy.
Neglected or untreated rhinitis or ignored cases can lead to other complications, which can be harmful in the long run.
Even interfering with his daily life, work, for kids interfering with the school, all those things.
Anybody, working class people, those who, you know, your day-to-day life is affected otherwise.
Yes.
Generally, you know, like there is a tendency that common cold, and you are getting sort of tuned to certain kind of ill conditions, and then you prolong with that, you take treatment, then you stop in between, and you know, instead of getting a complete cure, you prolong your life, and which can lead to this kind of situation where you explained.
Yes.
Isn't it? If you don't get it cured.
The problem is common cold is it can be due to a viral influenza. So that is a temporary thing. Usually our body will fight against it, and the virus will be out of our system in 5 to 7 days. So sometimes what people does is that they keep on using 𝐓𝐸𝐿 and 𝐓𝐸𝐻 nasal drops continuously. They start with the nasal flu. They might be having allergic rhinitis. Without recognizing that, for a flu they'll start and they continuously use it. But the problem with 𝐓𝐸𝐿 and 𝐓𝐸𝐻 nasal drop are that can cause a rebound phenomenon. For the problem they have been used for, the tissue size will swell up more. So patient will become addicted to these drugs, and in turn the patient will be having more difficulty from the usage of drugs alone. That is another terminology called as rhinitis medicamentosa. Due to the medicine, the problem is occurring.
Problem is, you know,
problem is occurring.
Is it so? Correct diagnosis, prognosis, treatment plan is very essential.
Yes. We need to diagnose it earlier. Then the treatment is better.
It should be done in pattern as suggested or directed by the physician or a surgeon, whatsoever it is. And what is the percentage of this, you know, like developing into a polyp or into a surgical case, doctor? See, for example, rhinitis, like allergic rhinitis, people come to you, get treated, and the percentage of which is developing into like the other complication you suggested, like smell effect, and or developing into a polyp factor which need a surgical intervention, etc.
More than 30% of the overall population is having allergic rhinitis. Okay, so when they don't get properly treated with that on prolonged duration of time, they can lead to nasal polyps. That depends on whether the patient takes the treatment properly or not. So if they are getting the correct treatment for it, no problem. Otherwise, if they are simply using these drops, as I mentioned earlier, they might land up in trouble.
And so this bifurcation, the differentiation is very essential.
Yes, yes.
മലയാളി വ്യൂവേഴ്സിന് വേണ്ടിയിട്ട് മലയാളി ശ്രോതാക്കളുടെ ആവശ്യത്തിലേക്കായിട്ട് ഞാൻ ചില കാര്യങ്ങൾ ഡോക്ടറോട് മലയാളത്തിലും ചോദിക്കാം. കാരണം ഇത് ജലദോഷം എന്നൊരു രീതിയിൽ ഇതിനെ പരിചയപ്പെടുകയും ജലദോഷത്തിനുള്ള ചികിത്സ കൊണ്ട് നടക്കുകയും ഇതൊരു നിരന്തരമായി ശല്യം ചെയ്യുന്ന ജലദോഷത്തിൽ നിന്ന് മാറി ഒരു അലർജി എന്നുള്ള തലത്തിലേക്ക് മാറുന്നതും അറിയാതെ വരുന്നതിനെയാണോ നമ്മൾ ഈ റൈനൈറ്റിസ്?
അതെ, കാരണം ഇത് അക്യൂട്ട് ആയിട്ടുള്ള പ്രശ്നങ്ങളും ഉണ്ട്, ക്രോണിക് ആയിട്ടുള്ള പ്രശ്നങ്ങളും ഉണ്ട്. അക്യൂട്ട് എന്ന് പറഞ്ഞാൽ അത് താൽക്കാലികമാണ്, അപ്പോൾ ആളുകൾ അത് തെറ്റിദ്ധരിക്കാൻ സാധ്യത കൂടുതലാണ്, അതൊരു കോൾഡ് മാത്രമാണ്. ക്രോണിക് ആയിട്ടുള്ള പ്രോബ്ലം എന്ന് പറഞ്ഞാൽ വർഷം മൊത്തം അതിന്റെ പ്രോബ്ലംസ് കൂടിയും കുറഞ്ഞും ഇരിക്കും. അപ്പൊ അങ്ങനത്തെ പേഷ്യൻസിന് അവർക്ക് തന്നെ അറിയാം എനിക്ക് അലർജി ആണ് എന്നുള്ളത്. അതേസമയം അക്യൂട്ട് ആയിട്ടുള്ള പ്രോബ്ലം, അതായത് അടച്ചു കിടക്കുന്ന റൂം പെട്ടെന്ന് നമ്മളൊന്ന് വന്ന് തുടച്ചു, പഴയ പൊടി ഭയങ്കര അലർജിയുള്ള സാധനമാണ്, അപ്പൊ അത് മൂക്കിനകത്തോട്ട് കയറി, അപ്പൊ അവര് വിചാരിക്കും ഒരു വൈറൽ ഫീവർ ആണ് എന്ന് പറഞ്ഞ് സാധാരണ കൈ കിട്ടുന്ന മെഡിസിൻസ് ഒക്കെ യൂസ് ചെയ്ത് ടെമ്പററി റിലീഫ് വരും. പക്ഷെ അത് കണ്ടിന്യൂ ചെയ്താൽ പ്രോപ്പർലി അലർജിക് റൈനൈറ്റിസ് ആണെന്നത് ഡയഗ്നോസിസ് ചെയ്യാതെ കണ്ടിന്യൂ ചെയ്ത് കഴിഞ്ഞാൽ അത് പ്രോബ്ലം,
അത് ആദ്യം പറഞ്ഞ രീതിയിലേക്കുള്ള മറ്റു രോഗലക്ഷണങ്ങളിലേക്കും കാരണങ്ങളിലേക്കും ബുദ്ധിമുട്ടുകളിലേക്കും
പോകാൻ സാധ്യതയുണ്ട്. തീർച്ചയായിട്ടും അതിനുള്ള സാധ്യതയുണ്ട്.
Is it സാധാരണ ചോദിക്കുന്ന പോലെ is it curable, doctor? Is it completely curable?
Curable എന്നതിനേക്കാൾ കൂടുതൽ പ്രിവെൻഷൻ ഇസ് ബെറ്റർ ദാൻ ക്യൂർ എന്നുള്ളതാണ്. കാരണം മേജർ എല്ലാവരും പറയുന്നത് തന്നെ അവോയ്ഡ് ദ അലർജൻസ്, അവോയ്ഡ് ഗെറ്റിംഗ് ഇൻസൈഡ് യുവർ നോസ്. You will be able to identify your allergens. Like immediately the body will start reacting it. Immediately you inhale it inside, it will try to push it out. So you will start sneezing, you will start running nose,
have cough.
Not your allergens. What are the list of allergens? Maybe one, more than one can happen. So try to avoid coming into contact with these allergens. That is better. But even though they have allergy, we have treatment. Nowadays even immunotherapy is there, which can give patient symptom free interval lasting for years. Even 10 years patient can be symptom free. But always in the body there will be an allergic tendency for these patients.
See, certain group of people, working class, in living in certain climatic conditions or one job related atmosphere, etc., where there is no escape for them as far as their life pattern is concerned. There is no escape for them from this so-called allergic elements. So in that case, are they are prone to continue with their
they can continue, no problem. Allergic nasal steroid sprays are a better way. If they have symptoms, they can use it. No symptoms, no need to use it. That can be done. Yet again, they can use barriers like nasal masks, so that it won't directly enter into their nose. So always I advise my patients, whenever possible, you wear a mask. If you're working in an office, you know that the allergen is in the office, like a cold AC or something from their working condition. Wear a mask. It's better.
Factory atmosphere.
Yes.
You find a lot of people working in factory atmosphere where you are exposed to, these kind of elements. The entire group of so-called inducive allergy inducive elements. Prevention on the first hand. Then
prevention. If it is too much severe, if we can't handle it, it's better to change the job.
Right. And what is the incidence and relevance of surgery? As a ENT surgeon, to what extent this can grow into?
Surgery for nasal polyps, we do surgeries because it is either partially or completely blocking the nasal cavity. The patient's sleep is disturbed, or is even life is disturbed. He can't breathe through his nose completely. Only mouth breathing is possible. He's not getting smell, recurrent sinusitis because of the blockage of the osteums. So in those patients, we do go for surgery, and we remove all the polyps inside the nose. And it's not like they can go home and no medicine at all. because there is a chance for recurrence. Recurrence for
this
nasal
is very
polyp.
important.
Yes,
very important.
it is very important because his system is allergic to certain things. It's going to be allergic. So definitely he need to come on regular follow-ups on nasal steroid sprays and other anti-allergic medicines. At least for few months he should be on the same.
Is sleep apnea anywhere related to this, doctor?
Yes, sleep apnea can be related. When there is nasal polyp, when it is blocking the nasal cavity, the patient can't breathe through the nose.
Then you have to, the only way is mouth breathing, and which is one of the reasons. Can be a reason for
even
sleep.
the rhinitis medicament also due to the regular use of nasal drop, that tissues inside the nose swollen up, and that can even give rise to obstructive sleep apnea.
Then as usual, as in the case of, like last occasion I was talking to pulmonologist, there again the significance of the corticosteroids, usage of corticosteroids over a period of time, and the dependency on and you have to, there is no way you cannot go back on the usage of corticosteroids. What is the impact in this case, doctor?
That is a myth actually.
That's a myth.
That is a myth. The patient is once on corticosteroids, should be always on corticosteroids.
Not necessarily.
Not necessarily. Nasal corticosteroids are more safe and effective than other nasal decongestant drops and all. When the patient is better, he can stop.
When it comes to the matter of curing a patient and getting treated properly, this is an effective and advanced mode of treatment.
Yes, it can be controlled well with corticosteroid, and it doesn't have much side effect like a systemic corticosteroid, because we are spraying it to the nose where it is needed, and the effect mostly only inside the nose. It won't go into your systemic circulation.
There may be cases, like lifelong, those who live in, I have friends, those who have migrated from Kerala, they live in Bangalore now, where with, I don't know, climatic conditions, etc., they complain of, ever since I went to change of living condition caused me this, and I can recall very well that ever since my migration to that particular city or town, this started happening. And
because pollution is more in cities like that, with the smoke outside, even the air that they are breathing, it is polluted.
Some people attach to certain plants, certain flowers, pollen related issues, and this Malayalatile ee paraganam nadakkunna pratyeka season.
Ade pollen oru main problem aanu. Pinne veettinathu bedroomukkalkathu chedi vekkunnathu nalladalla, kaaranam poopal poleyulla molds adil varan sadhyadayundu. Adupole ee bed mites ennu parayunna saadhanam nammade bed sheets il ottiyirikkunna sadhangal adu bhayangara allergen aanu. Unseen. അപ്പം നമ്മുടെ ബെഡ് ഷീറ്റ്സും പില്ലോ കവേഴ്സും ഒക്കെ റെഗുലർലി വാഷ് ചെയ്യുക, വെയിലത്തിട്ട് ഉണക്കി എടുക്കുക, കർട്ടൻസ് വാഷ് ചെയ്യുക, അതെ തീർച്ചയായിട്ടും കർട്ടൻസ് വാഷ് ചെയ്യുക. അങ്ങനെ അലർജിയുടെ സോഴ്സ് എവിടെയാണെന്നുള്ളത് കണ്ടുപിടിച്ചിട്ട് അത് ക്ലീൻ ആയിട്ട് മെയിൻറ്റെയിൻ ചെയ്യും.
നമ്മൾ ഈ ലിവിംഗ് മിത്ത് ഓൾസോ, like I told you in the beginning, the living myth also we should change. Like when you are inside an air conditioned room, you feel that you are living in a condition where you are more healthier, you are more clean atmosphere, which has to be, this is the myth, which is most of the people don't realize.
Yes.
This
because
has to
this
be
is unseen.
This has to be corrected. And doctor, there are few questions which have, since we are online and live, there are a few things which have come up. What is the worst reaction ever to occur due to an allergy? What is the worst reaction? One of the worst reactions ever to occur due to
anaphylactic shock is the worst reaction that can occur due to an allergy.
Doctor?
Anaphylactic shock.
Shock.
Allergy is not only allergic rhinitis. Allergy can be to foods, to drugs, or anything allergy can be. Okay?
Right.
And if something too much we are allergic to, it gets inside our system, then the patient can even go to a shock with reduced BP and larynx, everything, the breathing system swallow. If not treated at correct time, immediately, if we don't get
alarming to
can
life.
even lead to death.
This is very, it's a delicate issue.
Yes.
Allergy through, although we are discussing allergy, rhinitis, allergy through, like you said, food, like intake and close contact.
Previously, I come across such a patient. The patient has been no history of allergy, and നമ്മുടെ നാട്ടിൽ ചേന എന്ന് പറയും യാം. Okay, patient did take yam one day, and immediately she started getting anaphylactic reaction, and we couldn't save the patient because it was too much severe. The reaction was even with tracheostomy we couldn't save the patient. Patient was drowning. So it can be such severe also. She was not allergic to it previously.
It was all of a sudden came
all of a sudden she started
came up, and there was no previous history. You don't know about it.
No,
so
nothing,
for example,
nothing.
to explain
she has
it,
been taking yam previously also. Don't know what happened that day.
And now when here you have to do the treatment management, otherwise it was going to be a dangerous situation. The other question is this allergy causes itchy or rash all over the body? Is this allergy can allergy cause? Definitely it can.
More than this nasal allergic rhinitis, that is more towards some allergic to medicine, something going into our stomach and digesting and getting into the blood circulation, that can cause itching and rashes. Even some injections like painkillers or antibiotics that we prescribe on a daily basis.
It can also.
Patient may not be allergic to it previously, but today if he or she develops allergy,
we come across often, being in a clinic.
We come across
in the ER area particularly, emergency area we get particularly, and that is a reason for like we give them 10 minutes even for injection, test dose injections and these things. It also come in the arena of this allergy issues.
Issue.
And one particular terminology came up in this query is urticaria or urticaria?
Urticaria is nothing other than these rashes which usually disappears in 24 hours. It will appear on your skin and it usually disappears. That is also a form of allergy, but you need to be treated by a dermatologist.
If detected in the ER or any treatment area, then it has to be direct to
the dermatologist. If it's too much severe, then it need to be treated.
This is the relevance, like you were discussing earlier. What is the relevance of this kind of allergy-related rhinitis things leading to other areas of discomfort?
And we have skin prick test for identifying. We have skin prick test for certain drugs, for food materials, and even environmental factors. So that
can this be done for people like a person who is not having any difficulty as such, but when seeing a general physician or a surgeon, is it advisable that you do this kind of preventive allergy protective test like earlier? Do you suggest?
Definitely I suggest, but the problem with it is usually it is not covered under insurances. That is a problem because it is a preventive sort of.
But if needed,
patient need to do food allergens, they can common food allergens they can test, medicine allergens they can test, and environmental like pollen, dust mites, all these things in minute quantities they are injected into the subcutaneous tissue. And with the wheal and flare reaction, that is redness and itching, we can identify the patient is allergic to which product and not allergic to which product.
Right. This, they should keep a pattern of.
That test usually comes in a kit. So there are kits including 40 allergens. There are kits with higher number of allergens. So those tests, as I said, different categories. Testing food allergen is different. Testing environmental factors are different. Testing medicine allergens are different. So if the patient is undergoing that test, the allergic material not severe enough to cause an allergic reaction is injected into his skin, and after hours we again look at the areas. If there is redness and itching, then we can point it out as this is allergic to this patient.
See, people, this is a world of migration and travel. So, people across the board, irrespective of the climatic conditions, sudden changes, couple of hours time, maximum 10 to 12 hours time, you get into various climatic conditions and where you get exposed. What are the possibilities of the allergic?
If the allergen is previously recognized by the body, immediately when he comes into contact with it, body will start reacting with it. If the allergen he is not exposed to it his body before, then his body won't know if it is allergic to him or not. But if he is continuing staying there, the body might recognize it as an allergen and start reacting to it,
and then you have to find a mode of treatment.
That is mediated through this IgE, immunoglobulin E, type 1 hypersensitivity.
Another area where people get allergy reaction and exposed to it in the pattern of eating pattern and food, they are exposed to it, like people in the childhood, they eat fish, particularly seafood, prawns, etc., crab, prawns, etc., what I have come across in my
Peanut is a notorious allergic thing for some patients.
Yeah.
Peanut.
So how is it that, you know, like 10, 15 years, 20 years time, you did not have any problem, and after some time, see, I have a cousin sister who did not have any problem with seafood and prawns, etc., till 20, 22 years old. Later on, when she passed 30, 35, now she can't.
That is what I told. The patient I mentioned before, she was not allergic to yam till yesterday, but today severe allergic reaction occurred. Like that, even I was eating egg till yesterday, it was okay. From today onwards, if it is allergic to me, then tomorrow continuously it is going allergic to me. So
what is any particular reason to pinpoint, or just is a gray area?
It is actually, this is a type 1 hypersensitivity reaction. Don't know why body recognized it as an allergen. Some proteins involved in it.
With age, with growth, with you know, can be.
We can't say with age. At any age, it can occur. A child can develop allergy to a certain food. After 20 years, he can become allergic to a certain food. But if he recognized as having a food allergy, it's better not to try it.
Right. What are the chances of, like I told you, did not have allergy, developed an allergy? Is there any possibility that you get rid of that allergy?
That is immunotherapy. That is called as immunotherapy. That is a mode of treatment.
Not natural.
Like, it is not natural. Naturally, what we can do is, as I told you, if a kid is growing in a household with pets with lot of allergen from his childhood itself, even though his body is allergic to this material, it will develop a tolerance.
Right.
So that minute quantities of allergens, the body won't consider.
This is what happens cohabiting with pets,
yes,
etc.
Yes, from the childhood, if they are exposed.
Right.
Okay, that's it.
And the other thing what I told you, you are allergic to, I developed allergy to certain food. Then after some time, will it be reversed?
Can be, but usually we won't risk it.
People fear factor, and people won't risk it.
We advise don't risk it.
Are there any case which came to you, in your personal experience, did you come across anything?
Not reversed cases I have met, because usually.
Is there any new things? If there is any upcoming things, I can also, if there are any, please pass it on to me, which I can, because it's in the interest of viewers, so we would like to get maximum. Does slit cause anaphylaxis?
Slit, don't know really about that.
No.
Slit
No
causes anaphylaxis or not.
And this, I mean, as part of itching in eyes and nasal congestion is, like you mentioned, it's a part of.
It is a method of pushing out the antibodies and preventing it from getting our system.
Like even tears, and developing all sort of, body develops the natural pattern of resistance and getting on with. I think more or less things related to this particular disease has been discussed. Is there anything particular you would like to
I would like
conclude as, you know, this in the region, area, country?
We didn't cover is investigations, and investigations starting from a complete blood count will give us an idea about the patient have allergy, depending on the number of eosinophil count in it. If it is more, then we can go for absolute eosinophil count. Absolute eosinophil count usually ranges from 40 to 440. If it is more than 440, it indicates that the patient have allergy. 40 to 440 is the normal range. Eosinophil, absolute eosinophil count. More than 440 means that the patient has allergy. Then for specificity, we can even go for immunoglobulin E.
This will work well in the preventive sector.
Yes.
Well work in the preventive sector.
Yes. Then immunoglobulin E also we can do. Then
like a person who is coming to clinic, hospital for various other reasons, this can also be added on to.
Randomly, when we do an infections, complete blood count will show that eosinophil is high. And again, for identifying which he is allergic to, we can go for skin prick test. And as a treatment modality, nasal steroid sprays, antihistamine, then montelukast tablets can be given, and also immunotherapy. That is the one thing that can give patient years of symptom-free period. That is, minute quantities of these recognized allergens are injected inside the patient's skin gradually at repeated intervals, so that the patient tolerance, body's tolerance to that allergen is increased.
So generally you would advise people to live, lead a clean life, healthy life, and be careful about, like any physician or medical specialist will say, stick to a healthy diet. And the exercise and like work modules and other things, anything. See, people, I have known cases, those who have gone for started morning walks or jogging pattern, they have ended up in allergic.
Because maybe the climate,
early morning before sunrise, post sunrise situations, and all were attributed to his more healthier pattern of life, and ended up in a disease. There were cases.
They might be going out in a season where more pollens are there outside.
It was, see, like you develop a pattern by support or instigation from a friend. You start on a new lifestyle and you divulge into this kind of life conditions.
It doesn't mean that exercise is not needed.
No. Exercise, it should be healthier. It should make your life more healthier. And
if he has facing such problem, maybe after sunrise he can go outside rather than early morning,
which can be again
cold.
Closely monitored, and he can change the pattern of life as such. I think we can conclude this talk in the general perspective, and as an awareness campaign. As always from Abeer Medical Group, we will be in contact and on social media platform at regular intervals, at say a week's time, fortnightly gap. We will be coming and taking questions also, entertaining questions also in the live program, and dealing with more details and various other areas of specialities, which as usual we hope will be useful for the viewers. Thank you very much. Thank you, doctor. Thank you for your time.